The beautiful state of Colorado, known for its majestic mountains and vibrant cities, is now facing a serious public health challenge. As of today, August 20th, 2025, health officials have confirmed 21 cases of measles, a number that is causing significant alarm across our communities. This isn't just a statistic, it represents real people, real families, a real threat. The sudden re-emergence of this highly contagious disease is a stark and urgent reminder our fight against preventable illnesses is never truly over. The concern has escalated dramatically. Thousands may have been exposed at Denver International Airport, DIA. An airport is a crossroads where people from every corner of the globe converge, then disperse again. An infected person moving through crowded terminals, security lines, gate areas could mean the virus traveled far beyond Colorado's borders. This is a critical moment. Understanding the potential scope of exposure is the first step to containment. So, what exactly is measles? It's crucial to understand that this is not just a simple childhood illness characterized by a few spots. Measles, caused by the rubeola virus, is one of the most contagious diseases known to humanity. It's an airborne virus, meaning it can live for up to 2 hours in the air after an infected person leaves the area. If someone with measles coughs or sneezes, they release the virus into the air, and anyone who breathes that contaminated air can become infected. It is so contagious that if one person has it, up to 90% of the non-immune people close to that person will also become infected. About 1 in 5 people in the United States who get measles will be hospitalized. 1 out of every 1,000 people with measles will develop brain swelling, called encephalitis, which can lead to permanent brain damage. And tragically, for every 1,000 children who get measles, 1 or 2 will die from it. These are not just statistics, they are devastating outcomes for what is a completely preventable disease. Another insidious aspect of measles is its ability to weaken the immune system for months or even years after the initial infection. This phenomenon, often called immune amnesia, essentially makes the body forget how to fight off other infections it was previously protected against. The timeline of the illness also contributes to its rapid spread. A person with measles can be contagious for about 4 days before the signature rash even appears. Airports are modern marvels of connection, but they are also perfect incubators for the spread of infectious diseases. Think about Denver International Airport, or any major travel hub. You have thousands of people from different parts of the world with varying levels of immunity, all funneled into shared spaces. They stand close together in security lines, sit shoulder to shoulder at gates, touch the same handrails, use the same restrooms, and eat in crowded food courts. The specific timeline of the DIA exposure is particularly concerning. Health officials have identified specific dates and times when confirmed measles cases were moving through the airport. These individuals were likely in their contagious phase, potentially even before they realized they were sick. Every breath, cough, or sneeze could have released viral particles into the air, where they can linger for up to 2 hours. This means that even if you never came into direct contact with the infected person, simply walking through the same area of the terminal an hour later could have been enough for exposure. The people who passed through DIA during that window have now traveled to their final destinations, which could be anywhere in the United States or around the globe. A traveler heading home to a small town in rural America could introduce the virus to a community with limited healthcare resources. For public health officials, this creates a monumental challenge. The task of identifying and notifying everyone who might have been exposed at DIA is nearly impossible. While flight manifests can help track down some passengers, what about airport employees, family members meeting travelers, or people just passing through? In the face of a threat as contagious as measles, our single most effective weapon is not a new technology or a complex treatment, but a safe and proven medical marvel: measles, mumps, rubella MMR vaccine. The data on its effectiveness is overwhelming and unambiguous. 2 doses of the MMR vaccine are about 97% effective at preventing measles. 1 dose is about 93% effective. The vaccine works by introducing a weakened form of the virus to your immune system, teaching it how to recognize and fight off the real thing without causing the disease. The protection is robust and long-lasting. For most people with the recommended 2 doses, immunity lasts a lifetime. This is the foundation of community immunity, or herd immunity. When vaccination rates reach roughly 95%, it creates a protective wall that makes it difficult for the virus to spread. That wall shields vaccinated people and the most vulnerable, infants too young to be vaccinated, people with compromised immune systems, and the small fraction for whom the vaccine isn't effective. It's critical to address misinformation. The fraudulent claims linking the vaccine to autism have been thoroughly debunked by global studies. Major medical organizations stand firmly behind the MMR vaccine: Centers for Disease Control and Prevention, American Academy of Pediatrics, World Health Organization. If you're unsure about your or your children's vaccination status, act now. Contact your doctor or local public health department. They can review your immunization records and advise if you need a dose or a booster. While vaccination is the primary line of defense, there are additional practical steps everyone can take. Be hyper-aware of your own health. If you or a family member develops symptoms consistent with measles, like a high fever, cough, runny nose, red, watery eyes, rash, act responsibly. Before rushing to a doctor's office or ER, call ahead. That phone call lets the facility prepare and take precautions to protect others in the waiting room. Practice good respiratory hygiene. Cover your mouth and nose with a tissue or your elbow, not your hands. Wash your hands with soap and water for at least 20 seconds, or use an alcohol-based sanitizer with at least 60% alcohol. Stay informed about exposure sites. Public health departments issue alerts, including the Colorado Department of Public Health and Environment. Alerts list specific locations, dates, and times. Watch local news and official public health websites. If you are at a listed location, monitor yourself for 21 days, the maximum incubation period. This vigilance helps early detection and prevents further spread. In a public health crisis involving a virus as swift and aggressive as measles, time is our most precious and perishable resource. Every hour that passes, the virus can find a new non-immune host and extend its chain of transmission. The current situation in Colorado is not static, it's evolving by the minute. 21 confirmed cases today are a snapshot of the past. Those infections occurred 1 to 2 weeks ago. This is why public health response must be rapid. Contact tracing is painstaking work, interviewing infected people, identifying contacts from when they were contagious. It's a race against the clock. Find exposed people, assess immunity, provide treatment, or quarantine instructions. The urgency extends to the public's need for accurate, timely information. On social media, misinformation can spread faster than the virus. Rumors, conspiracy theories, medically unsound advice can create confusion, stoke unnecessary fear, and lead to dangerous decisions. Rely only on credible sources: the CDC, your state and local public health departments, your trusted healthcare provider. Following their guidance is not a suggestion, it's vital to the public health response. We cannot be complacent or adopt a wait-and-see attitude. The window to contain this outbreak is narrow. If we hesitate, if we delay vaccination, or if we ignore public health advice, we risk the cluster exploding into a full-blown epidemic. The time for decisive action is not tomorrow or next week, it is right now. The health of our community depends on the swift, responsible choices we all make today. The measles outbreak in Colorado is more than a news headline. It's a direct challenge to the health and well-being of our community. But it is a challenge we can absolutely meet if we act together, guided by science, a sense of shared responsibility. This is not a moment for division or blame. It is a moment for unity, collective action. The virus does not distinguish between us based on our beliefs or backgrounds. It simply seeks out those who are vulnerable. Our path forward is clear. First, we must prioritize vaccination. If you or your children are not fully vaccinated with the MMR vaccine, schedule an appointment with your doctor now. This single act is the most powerful contribution you can make, protecting yourself and creating a shield around those who cannot be vaccinated. Encourage your friends, encourage your family, encourage your neighbors. Make our community's vaccination rate a fortress. Second, remain vigilant and informed. Check updates from the Colorado Department of Public Health and Environment. Check updates from the CDC, heed warnings about exposure sites, and follow instructions if at risk. We are all connected in public health. One person's health affects everyone. Reaffirm our commitment to one another. Choose science over fear. Choose community over complacency. Choose action over apathy. Colorado's spirit of resilience and cooperation can contain this outbreak. Protect our loved ones and reaffirm public health for generations. Together, we can and we will stop the spread of measles.